Yes.
So there are several of them. I'm going to start with the Lab Aspire. The Health Officers Association of California requests $1 million to reinstate the Lab Aspire program and $102,000 to support a state public health microbiologist. According to the agenda, the 2012 Budget Act eliminated $2.2 million general fund for the public health laboratory training program known as Lab Aspire. This program provided local assistance grants to subsidize training, support, outreach, and education, and provided funding for doctoral candidate stipends and postdoctoral fellowships for individuals training for public health laboratory directorships. I'm now going to move on to hepatitis C virus prevention. Advocates have brought 3 proposals to the subcommittee. First is $600,000 for rapid tests. This proposal to provide $600,000 to the Office of AIDS to purchase rapid hepatitis C antibody test kits. The kits cost approximately $18 per kit, and the funding could purchase approximately 33,333 kits to be provided to community-based programs. Second, under the hepatitis C virus prevention proposals, is $3 million for a state syringe exchange clearinghouse. Advocates propose $3 million for syringe exchange and disposal programs by creating a state clearinghouse in order to purchase sharps, disposal containers, sterile syringes, and other materials for the operation of these programs. Third is a linkage and retention in care demonstration projects. Advocates request $5 million for the Office of AIDS to support at least 3 3-year demonstration projects to include innovative outreach, screening, and linkage and retention in care efforts for people with HCV. Moving on to the AIDS Drug Assistance Program and the Office of AIDS Health Insurance Premium Payment Eligibility Modernization. Advocates propose to expand eligibility for the ADAP and OA HIP programs. First, by updating family size. Financial eligibility for the OA HIP and ADAP are the same. Currently, the programs serve individuals with incomes up to $50,000 annually based on federal adjusted gross income with no regard for family size. Second, increase the income limit. Advocates also propose increasing the income limit of $50,000 for these programs, which is estimated to be 447% of the federal poverty level to 500% of the federal poverty level, or $58,350 for a single individual and $98,950 for a 3-person household. And according to the Department of Public Health, its preliminary estimate suggests that this proposal, if implemented, would cost roughly $5 to $6 million in 2015-16, but would result in savings in subsequent years. The next proposal for the AIDS Drug Assistance Program and the Office of AIDS Health Insurance Premium Payment Stability Funding. Advocates propose $2 million to increase staff, particularly enrollment workers, and propose an additional $1 million to implement program improvements identified in a study by the California HIV/AIDS Policy Research Centers. The next proposal, pre-exposure prophylaxis, access, and affordability programs. Advocates propose $3 million for a PrEP access and affordability pilot program that would include outreach and education, patient navigation, clinical and non-clinical provider training, and cost-sharing assistance for uninsured and underinsured individuals. The next proposal is an HIV demo projects in small counties. Advocates propose $3 million to support high-impact HIV services in small and mid-sized counties. And the last proposal that I'll be presenting is sexually transmitted diseases, prevention and services. Advocates are requesting $10 million to augment the current funding of $1.6 million for the STD control branch at the Department of Public Health for their support of local health jurisdictions with high STD rates for STD prevention efforts.
Thank you for your presentation. Let me first ask colleagues any questions to the panelists. I do have a follow-up question to Dr. Chavez. And first, let me say thank you to the LAO, and I'm very interested in the future in understanding from your department where you stand on some of these proposals around AIDS, HIV, and PrEP. But I wanted to ask a couple questions around hepatitis C virus prevention. You probably know in this year's budget, Governor Brown proposed an additional $300 million to go to one drug, Sovaldi, to help treat 3,500 patients with regards to that drug. And as was in the presentation, there are 750,000 Californians this year who are estimated to have hepatitis C virus. This is something that will cost our state $26 billion. And I want to just note that the proposals that have come forth from the community have been for about a total of about $10 million worth of additional proposals. From what the math that I've done, the $300 million that we've been asked to further budget in this area, my understanding is that our state agencies have been able to negotiate a 46% cut to those rates. And so it is my hope that what was initially budgeted, either we can provide additional drugs to hepatitis C patients, or I do think it would be appropriate for us to consider using some portion of that, maybe $10 million worth, for additional hepatitis C virus prevention programs. Could you give us your perspective on where we stand with regards to those programs?
Yeah, that's a very good point, and we are most appreciative of having some resources to invest in treating some of these folks. We actually have a very high-level group within our agency looking at the best way to utilize those resources and maximize the benefit of who receives treatment, so that we can, on a very consistent approach over time, treat those that need the drug the most first, but eventually, treat as many folks as can be treated with the funds available. We also are obviously very concerned about prevention. We know that we can do and need to do what we can to treat individuals, but we know that every year a very large number of additional Hep C infections continue to occur, primarily as a result of illicit drug use. So we feel that it will be very wise to both ensure that we treat those that need the drugs the most first, but also that we make some investments in prevention of those individuals at high risk for infection.
Thank you. This strikes me as one of those areas where an ounce of prevention really is worth a pound of cure. With that, why don't we now go to public comment? If I could ask folks to line up. And let's hear from the first speaker. Each member of the public will have 1 minute for public comment.
Hi, good afternoon. My name is Sylvia Castillo. I'm with California Family Health Council, and we are a statewide organization that promotes quality sexual and reproductive health care for all, and we appreciate this hearing on the DPH funding. Here in California, our state has made significant progress with reducing unintended pregnancies. However, the statewide STD rates are spreading fast and furiously, with more than 1 million Californians who are currently estimated to be living with an STD. Amongst this population, youth, communities of color, and men who have sex with men populations are disproportionately impacted. With over half of all STDs in the state being experienced among California youth ages 15 through 24. So a couple other stats. Nearly 90% of all male syphilis cases and more than half of all male gonorrhea cases in the state occur amongst men who have sex with men populations. STD rates among African Americans, California, are up to 26 times higher than rates experienced by their Caucasian counterparts. Approximately, and these disparities are particularly prevalent amongst STD hotspot counties like Sacramento, Alameda, Kern, Riverside, San Diego, and San Francisco. Approximately $1 billion is spent annually statewide on health costs associated with STDs. For all these reasons, a broad coalition of organizations are asking the state to increase more funding for local health jurisdiction capacity to prevent STDs through direct services, more robust data collection, research to develop evidence-based prevention programs. We've shared with committee members through visits in the district, as well here in the Capitol, that we have identified an existing infrastructure and funding stream that is distributed through the STD control branch to ensure that California has a strategic and multifaceted, coordinated and evidence-based approach to preventing STDs. So we are requesting that the funding be increased by $10 million to ensure that local health jurisdictions have greater capacity to fight STD rates. And CFHC also supports increasing funding for Hep C and HIV prevention. Thank you.
Thank you. Next speaker.
Hi, my name is Jeannie Riddell. I'm here in support of the infant botulism BCP. My son Scott had infant botulism many years ago, and I flew up from Los Angeles today just because I'm so passionate about this issue. If he had had baby Big, he would have been in the hospital just a couple of weeks. As Dr. Chavez said, this is a life-saving treatment. My son did not have that. We were in Children's Hospital LA for 5.5 weeks of terrible awfulness. And so as one of the parents, we helped pass the legislation in 1995 that gave evidence that this would all be supported, and we thank you for supporting it so far. The legislation also, as we follow it, says that the department will continue to do lab diagnoses and research and improve treatments. I work in a large hospital in Los Angeles, and I'm aware that much more can be done in this area. Thank you.
Hi, my name is Corby Selzer. My son had botulism also more recently in 2012, and he is evidence that this baby Big is very useful and potent and really helps save these baby lives. As a result of the baby Big, he was only hospitalized for just over 2 weeks as opposed to 5 weeks. So just as the literature states, that's what this is doing, just saving millions in health care costs as well. I also am coming to say thank you so much. I also had a social group, the social network group, the Facebook group for the infant botulism parents. So I've actually connected with many parents from babies that were affected many years ago, so we can talk about this very rare disease. Thank you for your time.
Mr. Chair and members, Rand Martin on behalf of the AIDS Healthcare Foundation. AHF is one of the advocates of the proposal to add $10 million to the STD control branch budget to go into its infrastructure to get more funding out to counties to deliver STD prevention and control efforts. I want to align myself with the comments from our ally here, the CFHC, but also expand on it by indicating that STDs are considered the largest reportable communicable disease in the state of California because of the large number of cases of STDs out there, much larger than any other communicable disease. It's large, it's largely unreported. It's a very much of a hidden disease. It's one that strikes a lot of people, especially in younger ages, but also strikes a lot of people in communities of color to a far greater degree than it does in certain other populations. Incredibly important to make sure that we give more than $4,500, which is what's happening in some cases in some counties, to counties in order to control STDs. $4,500 is not any amount of money to do anything with. I know that one county in particular indicated to me that they were having to innovatively use funds from other parts of their budget in order to get some degree of control out there relative to STDs. We should not be putting them in that position. We should be putting enough money in there to make sure that we are doing something to control this. We really urge the $10 million adoption of this. Thank you.
Aaron Fox with the Los Angeles LGBT Center and also a member of the California HIV Alliance, which is a coalition of HIV/AIDS organizations throughout California that joins together every year. And the budget proposals that you have regarding HIV came from our group, and we'd like to thank the committee for considering them and taking them seriously, as we think we are at a point in the HIV epidemic where we can truly end the HIV epidemic, and California can lead in that. In 2009, as was said, there was $82 million cut from HIV programs, wiping out all HIV prevention funding from the state of California. And I'm glad that the CDC study was brought up. Dr. Mark's numbers were right on. The CDC estimates that about 55 new cases per year resulted from that cut, and that's also about $20 million in lifetime treatment costs that are associated with cutting of that money in 2009. So at the point that we are now, we think that the proposal that the Alliance has put forth to the committee is a modest proposal. It's one that's rooted in evidence-based practices and scalable interventions that are components of us getting to zero new infections and ideally zero new deaths as well. And we think that with this modest allocation to really look at getting back into doing HIV prevention and linking people into health insurance and keeping them in care, that California can once again lead again in stopping the HIV epidemic. And we are extremely honored that you are taking a look at these proposals and that DPH has provided technical assistance, and we look forward hopefully to working both with the legislature and with the department on the implementation of PrEP specifically and other biomedical interventions that we know can stop new infections. And we also support increased budget allocations to STD and Hep C as well.
Thank you very much. I want to just interrupt for 1 second. I know this has been a busy afternoon for many committee members. I unfortunately need to leave, and I want to make sure we have quorum to be able to move forward and vote. So what I'd like to do is just make a number of motions so that we can open them, cast initial votes on them if we need to hold them on call. If we can start first with the items related to this particular issue, there's been a staff committee recommendation that we approve the infant botulism budget change proposal and recommend holding open the Ebola preparedness proposal to allow additional time to review. Is there a motion to that effect?
So moved.
Is there a second to that? Okay. Could you please call the roll?
Thurman, Bonta,
Aye.
Chu,
Aye.
Grove, Jones. That has 3.
Okay. That will pass, but we'll leave that open for committee members. And then if we could go back to issue number 4, there were 2 staff recommendations. I understand there's a desire to split those. And if we could first see if there is a motion with regards to the first recommendation of approval of the Office of Problem Gambling budget change proposal and the proposed placeholder trailer bill related to this PCP.
So moved.
Second. You call the roll, please.
Thurman, Bonta.
Aye.
Chu.
Aye.
Grove, Jones.
Okay, that's 3 votes. And then with regards to the second staff recommendation of approval of the biomonitoring budget change proposal and the April 1st adjustment, is there a motion to approve that?
So moved.
And I will second that.
Thurman, Bonta.
Aye.
Chu.
Aye.
Grove, Jones.
Okay, with that, with all these items, we will hold them open. And with that, why don't we now go back to public comment?
Good afternoon, committee members. My name is Courtney Mulhern Pearson. I'm here from the San Francisco AIDS Foundation. I want to thank the committee staff for such a thorough analysis of these proposals. I'm also here, as was mentioned, from the California HIV Alliance. We're in strong support of these proposals, which we feel like really strategic reinvestment in the HIV epidemic in California. I want to thank Assemblymember Chu for his comments about the efforts we're undergoing in San Francisco to get to zero, and really would look forward to and welcome the opportunity to work with the state on creating our own state plan to end AIDS. So again, thank you very much for this proposal, or for the analysis of this proposal, and we strongly urge you to consider funding all of our efforts. And we also are here in support of the STD, increased funding for STDs, as well as the increased funding for hepatitis C in California. Thank you very much.
Good afternoon, Craig Pulsfer from AIDS Project Los Angeles and also from the California HIV Alliance. I just wanted to highlight first, echo the words of my colleagues and their support for those proposals, and also just stress 2 of them. One, the investing in funding for administration of ADAP and OAHIP. DPH estimates the enrollment in those programs will nearly double next year with no increase in staffing or enrollment workers. So really important to make sure that those programs function effectively and investing in administration of those programs. And the other one was the proposal for a PrEP access and affordability program. As you know, this is an extremely effective HIV prevention intervention. Some studies suggesting it's 99 to 100% effective when taken properly. And a recent survey from Kaiser Family Foundation found that 80% of gay and bisexual men knew little to nothing about PrEP. So extremely important to invest in education and outreach and making sure people have access. So thank you very much for your consideration.
Good afternoon. Ann Donnelly with Project Inform and also with the California HIV Alliance. And I also concur with my colleagues, in support of this package of allocations. And I also want to thank the committee very much for taking this up. I did want to stretch that we really are looking at this as a package and that it really is important. We feel that we stand on the threshold now of being able to end this epidemic and are very thoughtfully targeting these programs. And I wanted to mention just one, which is the $3 million for a demonstration program in the smaller counties, because these are the counties where Dr. Chavez pointed out that the cuts have been particularly harsh and people have lost infrastructure, and we do see new cases of HIV cropping up in these counties now. So we again thank you for the excellent analysis, and we urge you to look at this as a package, and we also look forward to hopefully working with the state on a plan to end this epidemic. Thank you.